evening, you're with the news here. I'm Seher Zama. We're reporting yet another aspect of the COVID-19 virus on how it's behaving, and more frequently a trait that is being seen, which was just a bit seen in the first wave, but more now in second wave cases here. This is with respect to not being visible in RT-PCR tests. The virus is managing to jump and in not being shown as positive in RT-PCR tests. Hospitals are now getting patients here where a typical symptom of the disease is there, but it's still not showing at the RT-PCR. There are patients who are testing negative on the RT-PCR and are still carrying the virus. And how this is known that they're carrying the virus is the CT scan of their lung, which is done, which shows the infection. This is something that is now being closely tracked by doctors in many cities in this second wave.
To actually get a positive report on the lab test, we sometimes advise them a bronchoscopy procedure in which we go through a tube inside the lung and take a fluid from the deepest part of the tissue where the virus growth is the maximum. So many a times we are seeing the nasal cavity doesn't grow that much of virus load, or sometimes the technique can also be faulty. So that is a sure shot method that if that test also comes negative, then we are sure the patient is having something else. So bronchoalveolar lavage comes as a handy tool for all those patients which are coming repeatedly negative on a nasal cavity RT-PCR test.
So sir, you pointed out that even in first wave you saw this phenomena taking place. How many of the patients are going to are actually seeing this kind of treatment being done to them to ascertain whether COVID test is negative and now they are actually suffering from COVID?
So if I compare both the waves, first time it was one odd case once in a month where we used to have such a dilemma. The rest of the patient would either test positive on second or third time, whereas at this time we are seeing almost like 4 to 5 patients every week who have got this diagnostic dilemma.